Our next speaker is Magdalena Szpala from BC Housing, and she will be speaking to us on a case study. Magdalena, or Magda, is an uninvited settler on the traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations. In her current position as Director, Sustainability and Resilience at BC Housing, Magda is responsible for strategic leadership in integrating social and environmental priorities into the organization's activities. Magda was responsible for BC Housing's first carbon neutral action report and led the development of BC Housing's first climate adaptation framework. She's been working on BC Housing's extreme heat response for the last few years. She's also a co-lead for the Mobilizing Building Adaptation and Resilience, or MBAR, initiative that focuses on resilient building design and renovations. She holds a BSc with honors degree in psychology, a master's degree in strategic leadership towards sustainability as well. So please join me in welcoming Magda. Thank you.
Thank you very much. All right. It worked. So my name is Magda, and I'm with BC Housing. And I'd like to start with just acknowledging that at BC Housing, we are conducting our activities on the ancestral homelands of hundreds of Indigenous peoples and nations across BC, each with their own unique traditions, worldviews, languages, and history. And at this location, I am on the traditional, ancestral, unceded homelands of Musqueam, Squamish, and Tsleil-Waututh nations, who have been the caretakers of these lands for thousands of years. And I'd like to pay my respect to the peoples past, present, and future. So I'd like to begin with just saying a few words about BC Housing and what is it that we do and who do we serve, and then I'll share with you what we're doing to be better prepared for extreme heat and wildfire smoke events. BC Housing is a Crown corporation, provincial Crown corporation, and we have two mandates. So we are responsible for fulfilling the directions from the Minister of Housing. So we're responsible for the development, management, and administration of social housing. And some people don't realize that we have a second mandate, and that is under the Homeowner Protection Act. And that under that mandate, we have responsibility to strengthen consumer protection of new home buyers and improving the quality of residential construction. So BC Housing serves, we provide a full range of housing options on affordable housing spectrum, and I'll show you that full spectrum in a moment. We work with about 800 nonprofit housing providers across the province. We provided help to about 110,000 households last year, and that help ranged from emergency shelters, homeless outreach, transition homes, safe homes, Indigenous housing, supportive social housing, rent, and as well as rent assistance, and adaptation of homes for seniors and people with disabilities. We serve people who are experiencing homelessness, people with disabilities, women and children fleeing violence, low income, and then under the Homeless Protection Act, buyers of new homes. So here's that full spectrum of housing that we are involved in one way or the other. And you see that kind of goes from homeless shelters and efforts to address homelessness and outreach teams through social housing and then affordable home ownership. Not many people realize that BC Housing is one of the largest developers in the province. Last year we constructed about 4,000 new units and purchased about 300 existing buildings. So now I'd like to move on to talk about what we're doing with regards to extreme heat and wildfire smoke. And there's kind of three main focus areas for us. So the first one is really about protecting tenants and clients. And within that, there is two kind of distinct activities. One is related to tenants that are actually BC Housing tenants. So we are, I mentioned we are a landlord, so we have about 4,000 or 5,000 units where we have BC Housing staff and that we directly operate. And we also work with the nonprofit sector, who is responsible for about 90,000 units across the province. So we also play a role in terms of supporting those nonprofits as much as we can in various things. Usually our relationship is such that we are the funder of the work that they do. I mentioned buildings, so that's more of a sort of longer term activities in terms of what we do in extreme heat and smoke, and that involves both existing buildings, new construction, and research and education for the residential construction industry. So I'll talk mainly about those two areas, and of course the third area is collaboration. Just like the previous speaker said, none of this work happens alone. We work with a lot of different partners. We work with municipalities very closely. We work with health organizations, different levels of governments, various technical committees, and so on. But my presentation will focus on the first two. So after the heat dome, we were curious to see how many of the nonprofit sector were, how prepared did they feel. And so this is just a very, very high-level highlight. This was a very short survey, unscientific. It was just really for us to sort of getting a sense. So we had 150 societies that completed the survey, and only about 38% of respondents indicated that they have some sort of extreme heat response plan. The top things that emerged from that survey in terms of what would help them next time was access to funding. And the second one was sort of resources for how to do things, so how to create a response plan and how to communicate effectively. So here's just high-level key elements of the response plan that we have at our directly managed sites, and that we also created templates and other tools and resources for the nonprofits to use. And so obviously education and awareness is the first element, so we're providing training for our own staff. We are, since the heat dome, our communication team has been a lot more involved and has been preparing communication ahead of time. Maybe I should say up front that we had an extreme heat response plan for our directly managed buildings that's been put in place for a few years, and so during the heat dome it was activated. And I'm going to address Sarah's questions before she asks me what happened during the heat dome. So I'm going to say that, it worked and it didn't work. I think if we didn't have that in place, we probably would have seen more fatalities. But we did see a number of fatalities. So we know that despite our efforts, there were people that have, died because of extreme heat. That our efforts were not sufficient, and what they included was so notification system to our staff, opening of cooling rooms in all the buildings that have any kind of common area. Those common rooms have portable AC units as well as air purifiers. This was during COVID. I think the use of those rooms was probably lesser because of previous messaging about physical distancing, but they were used to some degree. And we also do tenant checks. So you see, one of the elements is we're doing an assessment of who is the most vulnerable in the building. To be honest, I would not want to be the person who's doing that kind of assessment. A lot of our buildings are specific buildings for seniors, are specific buildings that have a lot of people with disabilities. And so we know just by definition that they are all at risk, and yet we do need to sort of prioritize just because of lack of resources. In order to do effective wellness checks, it takes manpower, and we just don't have enough to cover everyone. So there is identification on who is most at risk before the summer, and then when the event happens, those people are being contacted, and those lists are being updated based on new information that's collected throughout the event. There is also sites that don't have those common spaces. So there are sites where rather than invite people to a cooling space within the building, we create maps of what are some other cooling centers available, such as libraries or community centers or other places, and share that information with the tenants. We have started being a bit more proactive, so we did have small inventory before the heat dome, and now we have a bigger inventory of portable AC units and air purifiers that can be distributed to the nonprofits in case of emergency. We've also been a little bit more proactive this year to encourage nonprofits to create their own cooling rooms ahead of time and purchase those items ahead of time. And like any response plan, we have a system for annual evaluation and review and evaluation. The big difference between what we have in place right now and what we had in place last year, so some improvements in terms of our own protocol, but the biggest difference is we are a bit more organized and have better communication and outreach to the nonprofit sector. So yeah, maybe I'll just leave it at that. So now I'd like to share a few different sort of studies or different pieces of work that have been informing some of our activities. This is a cover of a report that was commissioned by the Climate Action Secretariat, conducted by Shift Collaborative and URSU's Resilience Strategies. And they did engagement with organizations who are supporting vulnerable people and also engagement with people with lived experience, particularly with people with disabilities, with seniors, both in rural and urban settings, and with people who are unhoused or insecure at house. They've done a fantastic job of bringing some of the voices of people that they talk to throughout the report that they produce. I'm not going to give it justice in terms of bringing some of the voices, but I did want to bring up at least a couple so you can hear some of the comments that were collected in that engagement. So those two comments come from rural service providers. Oftentimes when systems are not in place to offer supports, those on the front lines and in community carry the load. These are the same people carrying the load for the rest of the year. Staffing capacity is stretched, resources are scarce, and people are tired. And that has been something that's been one of the biggest challenges that we faced last year as well as this year. The nonprofit sector is stretched. A lot of organizations are understaffed. And when we come up and sort of suggest that they take on additional work, such as providing wellness checks or other additional activities that are required in order to provide emergencies response during heat or smoke event, there is a major issue with capacity. And the other quote, isolation is a major factor, partially chosen as people move to a more remote valley. The mental part and the practical part of isolation is particularly hard for seniors with no phone, internet, or vehicle. We had extreme heat, extreme drought, extreme smoke, a deadly challenge for 4 days of extreme heat, for 4 days. People are unhappy or desperate and not feeling able or not aware to initiate accessing resources. To me, it was just really a great reminder of, when you look at the people that BC Housing serves and the list of people who are most at risk from extreme heat and wildfire smoke, oftentimes those are the same groups. And oftentimes, I work and live in Vancouver, and sometimes we forget the difference between working in an urban environment versus in more rural settings. So here are some of the key findings from that engagement process. Focus needs to be on cooling infrastructure, not just the cooling center. So really that recognition that when we're talking about extreme heat response, we are operating on this sort of emergency response mode, and we at the same time really need to work on those longer term and systemic solutions. And in our case, buildings are a huge part of that, which is why it's been so wonderful to hear all the previous presentations and some of the new suggestions for solutions. Heat response must be resilient to compounding effects. It's easy to just talk about one challenge. It's when it's hot, open the windows. But when it's hot and there is dark skies outside and smoke, that no longer works. So what do we do then? So really the importance of looking at a combination of the challenges that we're facing. Opportunity to use some of the learnings from our COVID response. I mentioned earlier, urban and rural communities have different needs. The fact that, just recognition, I think the conversation within BC Housing has changed a lot since the heat dome. I think we, as an organization, we were very much shaken up. And, I've been working on extreme heat for a few years, and it used to be, people ask me, what do I do? And I sort of mention something like extreme heat, and they're kind of like, oh, I could tell that they didn't see any kind of relevance to my work versus what's been happening. That's completely changed. Now there's a huge interest from our executive and the board and others, and the conversation has really shifted. So now moving to this sort of longer term and more systemic solutions that we're looking at. So in our case, there's kind of four main areas. I mentioned we're doing quite a bit of research and education related to buildings and focusing on building capacity within the residential construction sector. So we do research, and we publish a lot of our research, and we provide sort of practical tools. So there's a lot of sort of bulletins and guides for practitioners. We also conduct a lot of different training online and in person when possible. I mentioned earlier we are working on an initiative called Mobilizing Building Adaptation and Resilience. It's a multi-year and multi-stakeholder initiative that's really focusing on working with individual pilot projects in order to test the different concepts and ideas, and then capture the lessons learned and share those learnings. So it allowed us for a lot of different collaboration and various ways of exchanging and sharing information, such as having roundtables. BC Housing has, we have our own design guidelines and construction standards that are being updated on a regular basis. So that's for us a tool how we can influence how new buildings are being constructed. Although we're still operating within the reality of, it's not easy to change certain practices and the ways how things been done for many, many years. So we are leveraging our training and education arm to also work with our contractors on real life projects to make those changes. And we have a fairly large stock of existing buildings, and those are being retrofitted on sort of regular basis. There is a capital plan that allows for building upgrades and retrofits. So since the heat dome, we have commissioned a few different studies to help us inform our decisions. So this is an example of one study. Sorry, this one actually, that's been commissioned before the heat dome. Is one of the first attempts on our part to try and understand better what are the indoor environments in some of our social housing buildings. This study covered 25 suites across 5 buildings. They installed sensors that were capturing air temperature, humidity, CO2 concentrations, and as well as air tightness and airflow. And the study was conducted by RDH Building Science. Key findings from that study was that 4 out of the 5 buildings that were monitored experienced significant periods of overheating. And that means over 700 hours of overheating where temperature exceeded 26 degrees and peak temperature were well in excess of 31 degrees. And we also know a lot of our buildings, we conduct energy modeling and overheating analysis, and we know that that's not atypical for those buildings. Relying on opening windows as a cooling strategy was not very effective, and during the smoke, obviously that has consequences. What's interesting was that those suites were monitored before and after retrofit, and yet there was no changes, significant changes observed in the indoor environmental quality parameters before or after retrofit. Perhaps not surprisingly, because that's not been the main focus of the retrofits. And also the exhaust fans in many of those units did not perform as expected. So there's kind of interesting finding. There was an assumption that with operable windows, during the wildfires, the windows will be closed and the temperature will go up. That was not necessarily what that study showed, probably because That was a big assumption. Actually, there was no collection of data in terms of occupant behavior. However, one of the studies show an increase of CO2 concentration. So during the 2020 wildfire event. So that was an interesting finding. The recommendations that came out of that study really focus on suite level ventilation, as well as control. Many of our MERP buildings, they have central heating, and the tenants do not have any control over the heating. So really looking at changing that. Suite compartmentalization to improve the sort of air quality within one unit versus another, which would help with the transfer of pollutants. The recommendation for more active cooling, and installation of windows with lower solar heat gain coefficient, as well as providing airtight enclosure with adequate ventilation and filtration. And we not surprised by those findings. We have learned the hard way. We have a number of buildings that are very efficient in terms of energy, and some of those buildings were new, where we discovered that the issue of overheating was so huge that we actually went back to those buildings and needed to install cooling. So there's this notion of the importance of airtight enclosure, but with ventilation and filtration is slowly surfacing as something that's really, really important. Here's another study that we commissioned. This one was done since the heat dome, really looking at what are some different ways how we can realistically, with our budgets and with our buildings, what are some strategies for wildfire smoke. And you can see that the recommendations include upgrading the filters. So we had a great presentation earlier on about filters, and that is something that we're looking at bringing into our standards, requiring MERV 13 or HEPA filters. I mentioned we're already providing portable air cleaners to common areas, but we will be looking at expanding that to other parts of the building. And also looking at, existing, when we do have HVAC systems, how do they function, really looking at, are they performing the way they are being designed, and, are there things that need to be fixed. Optimizing airflow, providing supplemental filtration when needed. So we are looking at, sometimes it is not feasible to do MERV 13 filter all the time, but, can we do systems that would allow that to install higher level of filtration during the smoke event? And we're looking at ways how we can start getting a better sense of the level of pollution within the units by doing some monitoring. And then as well for new buildings, similar, really upping our filtration requirements for all sorts of different ventilation systems. Reducing supply of outdoor air. So we know anecdotally that some buildings that have had full-on ventilation, and during the wildfire smoke event, they actually ended up, I think, breaking law in some cases and turning off that ventilation because they didn't want smoke to be coming into the building. So looking at ways how that can be done in a more controlled way. And looking at sort of what are some of the options in terms of new technologies for air purification. So I should say those are all just recommendations from the consultant. Doesn't mean that we're implementing everything as listed here. But we will be looking at all those recommendations, and we will be updating our standards within the next few weeks, actually. And they will be focusing on additional filtration. They'll be focusing on requirement to use future climate files during building design in order to build in capacity for cooling in the future and more adequately addressing cooling needs right now. We will be more strict on requiring passive cooling design, so that may include, for example, external shading or overhangs or things like that. And similarly, we haven't been as stringent on our standards and requirements for retrofits. We'll be looking at transferring some of those requirements for major upgrades and retrofits. And I'd like to end with just a couple of examples of some of the publications that we've done. This is a design guide on overheating and air quality. It was issued a couple of years ago, but it does include recommendations with regards to air filtration. We also have a number of design strategies and suggestions for various climate-related hazards. So you can see just 3 examples there in terms of heat waves, power outages, and air quality, and other publications. We also will be looking at releasing climate-ready design guidelines. We're currently working on initial drafts of those, trying to make our buildings more resilient to the current and future climates. And I just would like to end with a quote that from Dr. Melissa Lamb in the recent Globe and Mail article, that Heat Dome has made it clear that we need to view cool and clean indoor air as a human right. Thank you very much. I don't think I ever got a standing ovation. This is great.
Do we have some questions? We've got one coming. Not sure if there's any online, and this will give you another few moments to think of the next question.
I applaud the effort for MER 13 and HEPA. I'm not familiar with, being from Alberta, the BC Housing Guidelines or the design guidelines, but how can people in the industry get involved in maybe helping design the design guidelines or make comments or?
I'll send you an email, and we would love more people getting involved. Yes, for sure. So we work with consultants, and our guidelines are published on our website, and we're always looking for constructive feedback and collaboration. So,
Okay,
yeah.
good. I look forward to it.
Yeah, me too.
In terms of outreach, has BC Housing looked at resiliency within the buildings? So even though there's large vulnerable populations, but supporting or encouraging interconnection between neighbors. So you're looking at a vulnerability list, but you're also identifying who's the least vulnerable and potentially able to help organize their neighbors to check on each other?
We had a great pilot project that we conducted with Shift Collaborative, who's been doing some work on resilient neighborhoods in Victoria and other places, and then the pandemic happened, and it was kind of put aside, and so we are just kind of really getting back to looking at ways how we can we do realize that is a very important factor, that the social connection is one of the best ways how we can be more resilient as individuals. We do have a community development program, but there is a lot of room for improvement and encouragement. A lot of our units are small units for individuals, so knowing that people who are most at risk were people who are socially isolated, we know that there is a need to address that, and there is some attempts, but certainly not what's needed.
Okay. Great. Well, thank you, Magda.
You're welcome.